Hi, this is Dr. Johnson. Today we would be discussing disruptive behavioral problems and whether our two main focus of today would be oppositional defiance disorder or ODD and conduct disorder. But there are other disorders that fall under this umbrella as well as behavior problems that do not meet the clinical diagnosis, such as subthreshold behavior problems. These still may be significant, just not clinically significant. A question you may ask yourself, how do behavior problems or disruptive behavior problems come to exist? And this is kind of the nature versus nurture statement that's stated quite a bit, and that means in a nutshell, genetics versus environment. To say look at different factors, contributing factors, especially with disruptive behavior. It can happen over time and it can get actually gradually worse if not addressed. But it can be a number of factors, whether biological factors, genetics, family dynamics, cultural factors, environment, but also learned behaviors. I like to say behaviors, especially in children, just like adults, is a way of communication. It may be an unhealthy way, but it is a form of communication. When considering factors such as genetics, this can increase the likelihood of behavior problems. But on the same token, so can environment. Let's say parents that may have conduct disorders themselves, depression, bipolar disorder, maybe ADHD, or are neglectful, may likely experience or display behavioral problems. Youth with behavior problems tend to cluster around three problematic areas, which is conflict with authority, destruction or theft of property or items, but also aggression towards others, self, or animals. As I stated, if the disorder or the behaviors are unaddressed, they can get significantly worse. You can view ODD on one end of the spectrum or continuum, and then on the opposite side, as they progressively get worse, it goes into more of a conduct disorder. Especially in the school system, these different behaviors will be seen across environments. In the school system, typically you would see testing, but you may see it in private practice. But the ones that I used to see as a school counselor before I'm in private practice was the Beck Youth Inventories and the BASC. The BASC is Behavior Assessment System for Children. So these were two common ones that LSSPs or counseling psychologists will do a variety of assessment inventories, and these are two typical ones that you will see regarding behavior. And an important element when you consider behavior are the interventions. So if left undressed, they are learned behaviors and they can continue operating until something changes. And one of these important changes is through behavior interventions. So one important part is not only to look at what people consider extinguishing these unhealthy behaviors or unsuitable behaviors, but also positively reinforcing positive behaviors or behaviors you want to see. And important people in this youth life or activities can really reinforce the behaviors that you want to see, especially whether it's at school or home or in a different environment. So two ways of doing that is through positive reinforcement. So you are reinforcing the desired behavior. So, for example, a positive interaction when the child is doing something they're supposed to do. But also, the negative reinforcement helps as well by taking away um, something that's not desirable. That's still negative reinforcement, but in a good way. You're taking away something that they do not desire. You're removing it if they're cooperating. An example might be chores or maybe extra work if they're showing the behavior that's supposed to be there, or I shouldn't say supposed to be there appropriately in that environment. Other useful interventions are through awareness and skills training. One of them that really stands out and I use in my private practice is mindfulness-based skills. So this is really allowing them to be more aware of themselves and their environment. So this is a big one as they're more aware of different elements, then they can they can respond in a different or more appropriate manner, healthy manner for their environment. Um, a second one that comes up quite a bit is items of really reflecting on thoughts, feelings, or behaviors, or in essence, CBT, cognitive behavioral therapy. In CBT, especially with behavioral problems, you're really looking at or allowing a child to reflect on how their different thoughts, feelings, or behaviors or actions interplay with different outcomes. And one element that I really like to use with CBT is sporadic questioning. So this is allowing them to reflect without giving them the answers or leading them down a path. It's and if done in a very appropriate fashion, you can really allow them to kind of stop and think if their behaviors are getting them where they want to be. It is very effective with dis disruptive behaviors. Um, but this also allows counselors to be there in a supportive manner, not in an interrogation kind of manner, but encouraging and validating, but also reflecting on this questioning process. There are other systems and methods that you can use. Other big ones might be DBT or dialectical behavioral therapy. And this has components of not only mindfulness, but emotional regulation that can be quite powerful with this group. And I like it's very structured, but there's a lot of tools in DBT that can really help um, any disruptive behaviors. Other ones you might see, and there's different names out there in different programs, but anything focusing on problem solving or skills based can be very effective. With any of these systems, one element to look at is the family system. Is when you consider parent training or parent information, you can you can really target or address these behaviors and thought patterns with the client or the student. But to really affect change, it's a wraparound, whether it's with family or other community factors can really help when you're talking about disruptive behaviors. I hope you took away quite a bit from this short mini lesson, and thanks for watching.